Hello, my name is Maria Paleologos, and in partial fulfillment in earning my master's degree here at Elmhurst University from the Department of Communication and Sciences Disorders, I completed a research study under the mentorship of Dr. Morian on the long-term effects of COVID-19 on cognition. So this was something that I was really interested in because, of course, we are currently in a pandemic, and in our lifetime, we never experienced something of this magnitude. So early on in picking my topic, I kept going back to what was going on in our present day, and COVID-19 was the biggest factor and the biggest current issue in our society. So let me zoom in for you guys. So early on in the pandemic, we started to become aware of the fact that this had much more than a physical impact. And in April of 2022, there were approximately 515 million cases of COVID-19 worldwide and 80 million cases in the United States alone. And we found out that there were multiple variants of COVID-19, and they had been evolving throughout the last 3 years and have been spreading throughout the world. And the most current research shows that 1 in 13 adults in the US has something called long COVID. And many of us might have experienced something like this, as this is quite a high ratio. And with this research, they also saw that there were a high frequency of individuals who recovered from COVID-19, however, still suffered from cognitive impairments. So, my research was to summarize what we knew or what we know about the impact of COVID-19 on cognition, to identify the gaps in the research that I have chosen, and to provide some clinical recommendations for future researchers. So I chose 5 studies that I found on sites such as PubMed, JAMA, Sage Journals, as well as a few others. And some of the keywords that I used were long COVID, cognitive assessments, and cognition. And now I'm going to jump into the basics of what these 5 research studies found. So we'll go up here. So, in one of the studies, the researchers administered cognitive screenings on individuals who had recovered from COVID-19 and found that 1 in 5 scored low enough to qualify as having a mild cognitive impairment. And so I wanted to know what the cognitive impairments included. And the primary ones that I found were executive functioning, memory, and attention. Now, something important to note is that executive functioning is a big umbrella term, and some things that fall under this term are planning, prioritizing, organization, and quite a bit falls under this term. So, with this, we now have a bigger picture of how it could really impact someone's life. And in addition, some other deficits that were noted through the screenings were things such as working memory, processing speed, fluency, as well as some other ones. And through my research, I found that there were indications that minorities were screened less frequently than individuals who identified as white, which led me to believe that the results of some of these cognitive screenings could be less representative of the population at large. Specifically, I found a study where cognitive screenings clearly did not mirror the racial demographic. So, this is also one of my recommendations, which I will discuss later on. However, it is imperative that research is more inclusive in recruiting diverse participants in their studies. And after looking at what cognitive impairments were found, I wanted to see if setting impacted the severity of those symptoms. And I found a study that found a significant increase in impairments among hospitalized patients compared to those who were outpatient, as well as those who were treated in the emergency department were more likely to have category fluency and memory and coding deficits than those who were treated in the outpatient setting. As well as a study also looked at the cognitive differences between individuals who recovered from long COVID versus individuals who never had COVID-19 to see if there was a difference in memory, language, and executive functioning. And the COVID-19 group was also divided into subgroups according to severity, such as recovered, ongoing mild, moderate, and ongoing severe. And the results from this study indicated that the ongoing severe group scored lower on memory tasks than in other groups, which was interesting. Oh, and we'll go up here. And now we also know that when the vaccines came out, there were disparities among which vaccine, who should get it, and all the politics behind that. So I won't be getting into the politics. However, I found a study that found that individuals who contracted SARS-CoV-2 reported a higher number of symptoms associated with cognitive dysfunction. And the participants were also divided into two groups, vaccinated and unvaccinated. And the study found that there was no statistical significance between vaccinated and unvaccinated individuals. And lastly, as a future speech-language pathologist, I wanted to know what my role would be in assisting against the fight against COVID, and found that in the research, speech-language pathologists have undertaken efforts to assist in evaluating and assessing individuals who present with these cognitive difficulties. And now I know that not all of you are future speech-language pathologists, so I wanted to kind of share a little bit of what our scope of practice is. And part of our scope of practice is to deliver services that include all aspects of communication, swallowing, and related areas. And specifically, I'm talking more about language as cognition, as this is most pertinent to my topic. And the study I found also discussed the impact that we could play in the pandemic. And in ending, my clinical recommendations to you guys and future researchers would be to consistently screen individuals post-COVID-19, and that we broaden the scope of our screenings to include the population at large, which current research does not indicate in this case in the studies that I found. And lastly, inclusion of other disciplines in treatment plans, such as speech-language pathologists, who could help address some of those acquired cognitive difficulties. In conclusion, I hope that you were able to take away some important information regarding the long-term effects of COVID-19 on cognition. And if you have any questions, please feel free to reach out. Thank you for listening to my presentation, and I hope that you all have a great day.